So let's dig into the concept of innovation. Let's start with the definition. The one I'm familiar with is that innovation is the creation, development, and implementation of a new product, process, or service with the aim of improving efficiency, effectiveness, or competitive advantage. First, does that definition work for you? And if so, how does one make decisions in the United Kingdom healthcare environment and introduce innovations that truly meet those parameters?
So that's a good definition. It's probably more sophisticated than the one that I use. So my definition of innovation is that it's about creating value from ideas. And the reason that I use that is that it's simple and people get it. So that value can be, as you say, increasing efficiency, effectiveness, or competitive advantage. And value isn't necessarily monetary. So it can be something that results in a better quality of life, for example. Decisions, for me at least, in terms of the decision to support the development of a new innovation, are all about feasibility and impact. So is the new innovation genuinely going to be realizable? And are the right pathways and levers in place in order to be able to create that impact and the benefit that we're going to need for our patients? So that's my position on how I make those decisions.
I like your definition, with one caveat. Different people may define the value of something differently. I remember hearing that when I was in the United States for many years, that chemotherapy was being given at home in the UK. And I thought to myself, wow, what a great idea. You've got cancer, to have to come in and out of the hospital, be exposed to, not a particularly nice environment, or to have a health visitor, a nurse, come to your home and administer the chemo. That's better. But if you're a for-profit medical enterprise, you're going to look at that and say, well, yeah, but that hurts my bottom line. So how does one deal with that dichotomy?
Yeah, and I think it's all about taking a consensus view, isn't it? We've had a lot of instances in the early days where people came to us with an unmet need and we thought it was a great thing to work on. But actually, when we started to dig into it, there wasn't a consensus view about whether that was the right direction to take. And as you say, where that value would be created amongst different stakeholders. So I think it is a matter of really doing your homework before you start to understand what that value means to the different stakeholders.
Yeah, but again, we're in the health business, so the patient ought to be at the centre of that value decision. But I agree with you. We have to work with different stakeholders.